Good morning, good afternoon, good evening. A warm welcome to yet another EPI-WIN webinar. Thank you all for joining, especially those of you from where it's very early in the morning or late at night. And for those of you who are familiar with EPI-WIN, as you know, we welcome you and we would like you to introduce yourself in the chat box. I'm Supriya Bezbarwa. Today, we have a very exciting topic. It's the global application of the One Health Joint Risk Assessment operational tool and what countries have done. As you know, 75% of all zoonotic disease, of emerging diseases come from animals. So how can we assess the risk together at the human-animal environment interface? This tool helps with that. And today we will get snapshots of what countries and regions have done using this tool and how it's helping to protect us all. We have a very exciting panelist list. We have from all corners of the world, actually. Dr. Stéphane de la Roque, who's the unit head in charge of this area, will provide the welcome remarks. Then On Prasan Fanik, who's a technical officer, will introduce the tool. Then we will hear about the countries. We have Dr. Sharon Calvin from Public Health Agency of Canada, from the foresight and risk analysis area, will talk about institutionalization of this tool in Canada. And from Canada, we will go all the way to Vietnam, where we have Dr. Hindo, epidemiologist from WHO Vietnam, who will explain the Vietnam experience. From Vietnam, we go to Nigeria. Dr. Nasir Ahmed, who's the One Health lead of the Nigeria Center for Disease Control, will talk about the Nigerian experience. And then we have Raymond Hamunga, who's a National One Health collaborator in Zambia, and the Zambia National Public Health Institute will talk about Zambia. From the country level, we will then go to the regional level. And Dr. Heba Mahrouz, technical officer at WHO Eastern Mediterranean region, will give the regional perspective, whereas the country perspective from Jordan will be provided by Laura Al-Sawala, public health officer in WHO Jordan. Then we go to Europe with Dr. Peter Hoskov, who's technical officer WHO Europe, and Professor Golubinka Boshevska, who's the head of lab for virology in the Institute of Public Health in North Macedonia. Finally, we go to the Southeast Asia region, where the beautiful country of Bhutan, how they have experienced the application of this tool in Southeast Asia. We'll hear about it from Dr. Narapati Dahal, who's the animal health specialist at the Department of Livestock. We would, of course, as always, love to hear from you, and please put your questions in the Q&A section. But we also want to hear if you have any comments or insights, put it in the chat, but questions in the Q&A section. Some housekeeping. This is being recorded, as you know, those of you who are familiar with EPI-WIN, and the recording will be shared from our website along with the presentation. Please do keep your comments to the topic and respectful. Here we're here to learn from each other and sort of strengthen our understanding of this area. Anything that is disrespectful, anyone who's disrespectful will be taken out of this webinar. With that, I hand over the floor to Dr. Stéphane de la Roque, and I hope you really enjoy this webinar. And at the end of it, please do not forget to respond to our survey. We always love to hear from you. So over to you, Stéphane. The floor is yours.
Thank you, Supriya, and good morning or good afternoon to all of you. I wish to start by thanking you for your interest for the joint risk assessment. This is a tool that has been developed jointly with FAO and WOHA a few years ago. And since it has been implemented in at least once time in about 70 countries and often several times. In fact, the JRA was the first of a series of operational tools, One Health operational tools, that were designed to complement the tripartite zoonosis guide. So the tripartite zoonosis guide, or the TZG, was updated in 2019, drawing from the experience gained in the management of multiple zoonotic disease, including avian influenza, of course, but also Ebola virus disease, H5N1, and many others, including zoonotic event of smaller scales, but equally significant from a public health perspective. These One Health operational tools that accompany the TCG are here to address certain areas of the guide that are known to be of particular challenging difficulty in the coordination between different sectors, particularly human health, animal health, and the environment. And in the specific case of the JRA, the objective was to establish a method that would facilitate the exchange of perspective between the different actors coming from different sectors and facing or preparing for a similar zoonotic event. And through this shared understanding of the different dimensions of such a disease, then it would allow a consensual assessment of the risk. For those of you who have had the opportunity to work on rapid risk assessments, you are very well aware on how it is challenging to grasp all dimensions of an event and to take into consideration the consequences that are not only related to public health, and that can also influence the scope, the nature, and the scale of the response. And the JRA is here to offer a methodology that helps to reconcile these different perspectives. Em, in 1 minute, will brief you and explain how this well-established approach has been developed and is organized. And then we will have many examples from different regions that will allow us to see how this is implemented operationally in countries. So I would like to thank all the speakers in advance, and I have really already spoken far too long. So I will let our speakers guide you through the world of the JRA, and would like to express my sincere thanks to all of them for their participation. And once again, to all of you for your interest. Have a good webinar. Thank you.
Thank you so much, Stefan. Now, before we go to the technical part of the webinar, we'd like to hear from the participants. So as you know, those who are familiar with EPI-WIN will know. We'd love to hear from you, so please do go to slido.com, hashtag 2142768. Slido.com, hashtag 2142768. So, first question. We have two questions here. You know, you're talking about joint risk assessment due to zoonotic diseases. How confident are you of recognizing the risk to you of zoonotic diseases in your daily life? You know, do you think about it when you go shopping? You know, maybe when you break an egg for omelette? Do you think about whether you're at risk, whether what it means for you in your life? Oh, sorry about that. I don't know what happened to my screen, but we will bring it right back. Right. And in your daily life, how often do you think of the risk to you of zoonotic diseases? Rarely, often, occasionally, rarely. You know, to be honest, for me, I have to admit, I would say rarely, because still I spoke to AIM, which is on arm, and she asked me that question. I thought, oh my God, I never really thought about it. But that's the point of this webinar, to start making you think of the risk. So great, occasionally is what we have here for most people. I will leave this on so you can continue to give your answers. We'd love to hear from you, but now we will go on with the technical part of the webinar, and we request Dr. Ong Arn Prasant Panik, Technical Officer WHO, to tell us more about this tool. Over to you.
Good morning, good afternoon, everyone. I'm Ong-On Prasanpanich from the Human Animal Environment Interface team here at WHO headquarters in Geneva. I would like to introduce to you this joint risk assessment operation tool itself before we go on to hear about different applications around the world. This tool was developed by the tripartite, the World Health Organization, the Food and Agriculture Organization of the United Nations, and the World Organization for Animal Health. It's been piloted since 2018 and been used in more than 68 workshops around the world already. Some countries have already implemented as a national process, and you will hear more in later presentations. So when we talk about the joint risk assessment, we think about this overlapped area that a shared risk between humans and animals in an environment is considered. Why exactly do we need a joint risk assessment? Because generally, when different sectors think about a same hazard, they might estimate risks very differently. For example, avian influenza. And when we do this joint risk assessment, we ask multiple sectors to come and look at this risk, a shared risk together, and assess it together. Even though we do it together for a joint risk assessment, but sector-specific risk assessments are still important in a way that they are valuable so that different sectors can manage their own unique risks, and also to provide different perspectives to inform the joint risk assessment. There are 10 steps of the joint risk assessment operational tool, but because we don't have much time, I will go into the details of only the main technical steps of the tool. We will start with the risk framing, which is to define the specific hazard that you would like to do the risk assessment together collectively. You would like to try to be as specific as possible going into the subtype or the strain of the disease, because later on we will identify the risk pathways, and different types of the disease or different strains, different subtypes can have different risk pathway. The next step is identification of the risk pathways. The risk pathways are the logical sequences of movements of a disease or a pathogen from the source until it infects a host. And here that we have on the screen is an example of the risk pathway for avian influenza. And we have different colors of arrows to indicate different transmissions. The blue arrows indicate animal-to-animal transmission, the red arrows indicate the animal-to-human transmission, and the black arrows indicate human-to-human transmission. And why are the risk pathways helpful? We identify them in order to identify the points that we can intervene for risk mitigation or risk management. As I mentioned earlier, different strains or subtypes of a pathogen or diseases can have different pathways, so try to be as specific as possible when you define a hazard. The next step is to formulate risk questions. For each question, you start with what is the likelihood and the impact of what, which is the pathogen, where, when, and how. An example of a risk question is, what is the likelihood and impact of at least one consumer in the country being exposed to avian influenza H7N9, where in a live bird market, and when in the next 6 months? You can have more than one risk assessment question, And for each question, you estimate the likelihood, you estimate the impact, and you assign the uncertainty for each likelihood and each impact. For when you don't have a lot of information to provide justification or to provide a rationale, you assign high uncertainty. Once you have the estimates for the likelihood and the impact, you come to plot them in a risk matrix on the right-hand side. So you plot them where they both fall, and you can see that here for this operational tool, we would like to steer you towards the risk mitigation or risk communication options. So in the red area, for example, it means that it's critical for you to implement mitigation measures. For yellow, you should review and adjust the mitigation measures. And for green, what you have right now or what you've done so far is fine, just maintain them. So we don't try to suggest that the risk is high, the risk is low, but we try to steer you towards the options, how you can mitigate, how you can manage the risk that you are assessing. So the last step is to interpret everything on paper. So you provide the justification and rationale why you provide a likelihood such an estimate, you provide rationale why you provide an impact such an estimate, and also the level of uncertainty. If you lack information, you provide high uncertainty. If you have quite comprehensive information, the uncertainty can be lower. So I will stop here. If you would like more information, please feel free to visit our website, which has all the operational tool information that we have in the toolkit, including this joint risk assessment operational tool. And enjoy different application presentations that you will hear afterwards. Thank you.
Hi everyone, my name is Sharon Calvin. I'm here on behalf of Dr. Jan Trumbull-Waddell. I'd like to thank you for this invitation to share some insights with you on how we institutionalize the JRA operational tool in Canada. I'd like to take the next few minutes to highlight some of our critical success factors, share some lessons learned and challenges, and provide a few examples of risk assessments we've done with this newly established process. Two critical success factors that we'd like to highlight are organizational readiness and scientific leadership. In Canada, coming out of the pandemic, there was a call for improving our risk assessment process, having oversight and coordination to support standardized risk assessments. Our agency sought out best practices and gold standards to determine if there were any tools, processes, or activities that could be applied for public health in Canada. We needed to lay out a plan for how we would do risk assessments, and the JRA tool became a central component as we adapted it to fit within our context. There was both a need and desire at the organizational level to connect with other federal partners and multiple sectors to improve communication and collaboration and respond to risks. The JRA tool showed us that it could become the backbone of how we would consistently apply a risk assessment process. This was important as emerging issues illuminated gaps in knowledge and processes, especially where multiple sectors were involved. The JRA tool provided the foundation, principles, and key activities to ensure we could conduct comprehensive and quality risk assessments, including multi-sectoral and One Health risk assessments. Another critical success factor was scientists, technical experts, and risk assessors needed to collaborate to integrate and interpret evidence to inform risk assessments. For example, the development of our One Health approach to risk assessment, or OHRA framework, which was built off the JRA tool, provided the support and clarity of roles and responsibilities, a mechanism to work in areas of concern where gaps in risk assessment exist, strengthened networks and interactions, and supported the co-development of scientific products. The alignment of organizational readiness to support the scientific leadership led to the development of our risk assessment processes, including the endorsement of the OHRA framework. I won't spend too much time on this slide, but it includes the link to our website for more information. The OHARA framework guides the process and approaches we would use for multi-sectoral and One Health risk assessments within the Canadian federal system. It's a series of modules to guide risk assessors and those who request risk assessments within multiple sectors and disciplines in Canada, including generic operating procedures in Module 4 that are very closely tied to the steps of the JRA tool. We'd like to share some of our key lessons learned and challenges. We learned that it's important to establish support early across federal multi-sectoral levels prior to conducting a risk assessment, to establish a clear roadmap for action in order to navigate existing processes and standards within the scientific and technical community, and to adapt and be flexible to work in different situations within the current context. We face challenges as well that have been instrumental in building support and understanding for how we conduct these risk assessments. For example, how to ensure active multi-sectoral participation when the areas of responsibility don't align perfectly to areas of accountability. And these happen when there are competing priorities, lack of resources, and when there are differing opinions on whether a risk assessment should be done. Another example is finding a balance between the level of detail and considerations to support response and planning efforts. Sometimes it's difficult to adapt the steps to a very rapid risk assessment process, so we need to look at other mechanisms in those situations. And as with many risk assessments, we're dealing with high uncertainty and knowledge gaps, which often places pressure on the analysis. And lastly, we've had the opportunity to test our approach out multiple times for various infectious hazards. A few examples are on this slide along with links. Our journey has just begun, and we feel there's still a lot of work to do while we're still in the early days of adapting the JRA tool as a regular process in our day-to-day risk assessment activities. However, the process is helping to connect and co-develop scientific risk assessment products in areas where there have been gaps or challenges. We'd love to learn more from others and welcome you to reach out to us at any time. Thank you.
Greetings, colleagues. Today, I would like to share with you a snapshot on how Vietnam has been making efforts to institutionalize JRA assessment for zoonotic diseases and events. Our 7-year journey started in 2018 when I got the opportunity to join the tripartite JRA Regional Facilitators Training at the FAO headquarters in Rome, Italy. In 2019, Vietnam was among the countries piloted the JRA operational tool. A 3-day coordinated surveillance JRA workshop was conducted in Da Nang City in February. Following that, in 2020, the tripartite JRA operational tool was officially published, as many of you might remember. During 2020 to 2023, the JRA tool was contextualized and translated into the local language. We provided training mainly at national and regional level at that time. We applied the JRA tool in various zoonotic diseases events, such as avian influenza, H5N1, H5N6, H5N8, H9N2, swan influenza, H1N1, rabies, anthrax. The JRA tool then continued to be further refined and adapted based on the experience from the actual application. In 2023, the government, both the human and animal health side, jointly organized a consultation workshop to finalize the national JRA guideline. In that workshop, JRA was also conducted for avian influenza, for rabies, and anthrax. Those are the disease events that were facing around that time. From last year until now, efforts continue to be made for institutionalization, while JRA continue to be conducted as required. Some events which JRA is conducted for included avian influenza, such as H5N1, H9N2, and most recently, Streptococcus suis was happening in a central region of Hue, where we work with the local authority, health sectors, and Pasteur Institute in Nha Trang to conduct the JRA to inform the coordinated response. This slide just highlights some photos from the key JRA events, which I presented in the earlier slide. You can see from the inception of the facilitator training to the pilot application to the development and finalization of the national JRA guideline and to actual JRAs that were conducted on the ground for multiple events. Looking back at the JRA journey in Vietnam, here are some enablers and remaining challenges. In terms of enablers, we do see that the government recognition of the risk assessment as the key tool for public health decision-making. There is a high value placed on JRA by relevant sectors for enabling the informed and coordinated One Health responses. There is a sustained commitment from both human and animal health sectors since the pilot application in country. And last but not least, trusted technical expertise from WHO and FAO with strong collaboration and coordination between agencies. Having said that, there remains quite a number of challenges that we have to overcome. First, there is the variation at national and subnational levels in terms of technical capacity, awareness of, and commitment to JRA. There is a suboptimal participation from sectors beyond the human and animal health sectors, such as environmental health, food safety, trade, security, just to name a few. There's also lack of collaborative follow-up action after and in between JRAs. And most importantly, the prolonged pending official approval of the national guidelines on JRA has been hindering the effective and systematic application of the joint risk assessment in country. Moving forward, here are some key priorities that we look at. Number one, ensure JRA is the pivotal component in the epidemic intelligence by including it in the ongoing revision of the disease prevention law in Vietnam and also in the National One Health strategic planning for the next 5 years. Second, finalize the institutionalization process of JRA in Vietnam via official approval of the national guideline and also providing the training to further build the capacity for the One Health workforce. And last, keep conducting the JRA for zoonotic and climate-sensitive diseases event in country, encouraging more participation from relevant sectors and quadripartite partners in country. With this, I would like to end my presentation here, and I thank you very much for your attention.
I'm Dr. Nasir Ahmed, and I'll be talking about the rollout of Joint Risk Assessment Operational Tool from the national to subnational levels in Nigeria. The Joint Risk Assessment Operational Tool was first operationalized at the national through a workshop where participants representing the One Health sector were trained on the use and application of the tool. We applied the tool to assess the risks of rabies and Lassa fever based on scenarios. Additionally, in 2022, a joint risk assessment on anthrax and invasive blue tick was conducted, bringing together national One Health stakeholders, and this also served as an opportunity to train representatives from subnational across the human, animal, and environmental health sectors. Here, we trained 3 states. Following this, we conducted JRA workshops for the subnational to strengthen their capacity on the processes and application of the JRA tool to assess risks of shared health threats. The first was River State in 2022, where we focused on Lassa fever and Indian influenza. In 2024, similar workshop was conducted for Ebonyi, Kaduna, and Jigawa states, where we assessed the risks of yellow fever, rabies, and mpox, respectively. The states trained were selected based on the fact that they have an established multi-sectoral platform like the JEP. Prior to the training, participants were asked to complete an online JRA training via the Open WHO and then presented the certificates during the training. Pre and post tests were incorporated into the training, and each workshop brought together 4 participants from each sector across the human, animal, and environmental health sectors. In total, 7 states out of the 36 states plus 1 were trained on the use of the JRA tool. Thank you, and over.
Hi, everyone. I'm Dr. Raymond Hamwanga with the Zambia National Public Health Institute, and I'm happy to share our experience as Zambia, and thank you, WHO, for the opportunity to do so. Our journey starts way back in 2023 when we conducted our One Health Zoonotic Disease Prioritization workshop with over 70 participants from the human, animal, and environment sectors. And this was really driven by us having conducted a national bridging workshop with the same stake key holders, and this was an inclusive multi-sectoral process to identify the country's top priority zoonotic threats. The outcome was a list of 10 priority zoonotic diseases. And the aim of the JRA was to assess these diseases in terms of risk to public health, animal health, and the environment, and to guide our preparedness and response efforts. So we conducted 3 sessions in total for these conditions, and this is something we've done over the past 2 years now. So the first session covered 3 diseases, and last year we conducted another session for the next 3 diseases, and just 2 weeks ago we conducted the 3rd session covering the remaining 4 diseases. In its joint risk assessment, we assess the risk by scoring likelihood, severity, and potential impact, as well as identifying drivers of risk and opportunities for mitigation. The process was facilitated by the Zambia National Public Health Institute and involved other multi-sector participants, including our partners WHO, FAO, as well as UKHSA and USCDC, and the result was a shared risk profile for each disease that can be used to align interventions and resources. We therefore now have a comprehensive multi-sectoral understanding of the risks posed by all 10 priority zoonoses in our country. The JRA process strengthened collaboration, communication, and trust between sectors. The results provide an evidence base for coordinated risk reduction strategies, and currently we are drafting manuscripts to document our methods, findings, and lessons learned, which will be useful for both national and global audiences. The outputs are also informing refinements in our preparedness and response plans, and we aim to integrate JRA results into our broader One Health emergency risk management framework. Thank you for your attention, and over there is the list of our priority zoonotic conditions.
So you've heard about the different countries. Now a quick break for some questions. Over to you, Aim, to ask some questions that our participants have asked to our panelists.
Thank you, Supriya. So we've had a few questions, and different speakers have already tried to answer the questions in the Q&A box. So if people can see the answered questions, you can go there and read the response that we have put there so far. And I've seen that we have a question about qualitative versus quantitative risk assessment. So I would just like to respond very briefly and also open to some other speakers to mention it. So for right now, the JRA operational tool is a qualitative risk assessment because we use different information from different sectors, and we might not have the best information to do it quantitatively. So right now, the approach is qualitative risk assessment. But if your country has very, very good information that you can do quantitative risk assessment, I believe that you can feel free to do so. I'll open to other speakers to respond to this as well.
We have another important question that is coming again and again. It's about, what is the position of JRA vis-à-vis other tools that are used to assess risk? And there is one specific question about the STAR, the strategic tool for assessing risk. And in fact, the STAR is also in the unit. So we are also supporting the implementation of this tool. What is important is to keep in mind that the JRA has been developed to facilitate the dialogue between different actors for a specific risk that can be chosen by a country. So here we are talking about facilitating the discussion between different parties. So it's very much about helping the multisectorial coordination, guiding the different actors through a process where they have the opportunity to exchange their view. While in the case of STAR, for example, we are talking about something completely different, which is a discussion that helps still in a multisectorial way to try to identify and prioritize the main risk, the most important risk that the country is facing. So we are not talking about the same thing at all. But we have to be careful when we use the term risk, because there are so many different ways and different directions in which we work when we want to assess, or we want to help to identify or to prepare the people to face a risk. So let's keep that in mind. But happy to continue the discussion if you want.
Thank you, Stefan. So thank you. I will just mention that there is a question about rabies or the standardized data collection for some certain diseases. So I'll keep it for now, because the last speaker from Bhutan will address rabies specifically, and we might be able to address some of that during his presentation. So we can continue the presentation for now, and please, speakers, feel free to support the answering of the questions in the Q&A box, and hope you enjoy the rest of the presentation.
Thanks, Aim. Just before we go to the presentation, just a quick ask to all the presenters. Is there anything that you would like to add to what has already been presented? Very briefly, because we do have time constraints. No? Okay, then we continue with the presentation. Thank you.
Hi everyone, I'm Heba Mahrouz, the One Health Technical Officer for WHO AMRO. I'd like to thank our colleagues for organizing such very good event on the JRA. First, let me take you through how we operationalize One Health within AMRO. So we consider our mission is to support member states to operationalize One Health, to establish such coherent coordination collaboration across multiple sectors and disciplines. And all of these is aiming at the end to enhance the preparedness and response capacities of the member states towards mitigating the burden of the health threats that the human-animal environment interface on those countries' population, health, livelihood, and economy. We had a lot of achievements. We managed to organize 2 big One Health regional meetings 2 years back and this year. And this year was in collaboration with the World Bank and government of Tunisia. We, in collaboration with the regional quadripartite colleagues, managed to establish our multi-sector coordination mechanism and develop our regional quadripartite action plan. We supported member states to develop their One Health workforce capacities. We, within AMRO, we managed to develop a One Health AMRO task force that comprises different units and departments working on One Health relevant areas, be a part of different initiatives and working groups within AMRO. As you can see, a long list of working groups. And finally, to support member states in development of National Action Plan for Health Security, more specifically on zoonotic diseases, AMR, and food safety. Also support some number of exercises like the after action review and simulation exercises on zoonotic diseases. For JRA in AMRO, we really believe in this tool. We have applied this since April 2018 till now. As you can see, a number of diseases have been covered through this exercise. We supported many countries within AMRO, and we had a large number of professional staff have been trained on the use of JRA tool. In conclusion, we really consider this tool as an excellent entry point to kick off coordination collaboration across sectors. It needs minimal coordination and preparation ahead of the workshop, but really it's so interesting during the workshop, and we had a very good result at the end of the workshop. The results of the JRA exercises used in many countries for resource mobilizations and succeed in having funds for operationalizing the One Health. Also, we use this tool in preparation of global events. For example, in Qatar, we use it before the World FIFA Cup. Finally, all the outcomes that addressed during the discussion of JRA workshops, it highlighted the gaps in the current mitigation measures for zoonotic diseases, and all of these used to update the plans, protocols, and guidelines in the strategies concerning zoonotic diseases and other health threats in the human-animal environment interface. Just before I forget, we had a lot of fun during the workshops. As you see, some colleagues, they found their passion in drawing while drafting the risk pathway. Thank you, and over to you, colleagues.
Implementation of Joint Risk Assessment Operational Tool in Jordan. One Health approach has been clearly and highly recognized by One Health sector's officials, and the roadmap has been drawn and followed. 7 zoonotic diseases were identified as being of great significance, including rabies, Middle East respiratory syndrome, avian influenza, brucellosis, leishmaniasis, rickettsiosis, and salmonellosis. Simulation exercise has been carried out on avian influenza involving all relevant sectors. To advance the implementation of One Health in Jordan, Joint Risk Assessment Training Workshop was conducted in Jordan in 2022 and delivered by WHO, EMLO, and FAO, utilizing the tripartite Joint Risk Assessment Operational Tool. Representative of all sectors that are involved in zoonotic diseases outbreak investigation, control, surveillance, and risk assessment were trained on JRA operational tool to conduct risk assessment for rabies and H5N1 avian influenza. JRA enables authorities in Jordan to implement science-based measures and align messages and communication among sectors. Jordan has undertaken multiple iterations of joint risk assessment on multiple diseases, and the results have been used to develop pandemic fund proposal, update rabies surveillance and case management protocol, implement WHO integrated surveillance on ESBL producing E. coli using the One Health approach. Thank you.
Hello and greetings from the European region. My name is Peter Sosa-Roscoe and I manage the Food Safety and Zoonotic Diseases program here at the WHO Regional Office for Europe. In my very short intervention, I'll give you an example of how we have introduced the JRA operational tool in a sub-regional context, and my counterpart Golubinka from North Macedonia will talk about how the outcome of the sub-regional initiative was taken forward at a country level. Following several One Health initiatives in the Western Balkans, in September last year, we organized the sub-regional workshop on joint risk assessment for zoonotic diseases. The workshop was for 2.5 days, and it aimed to strengthen the capacity of countries and area in Western Balkans to conduct joint risk assessment for priority zoonotic diseases and to define priority follow-up action at the country and area level. The workshop was attended by 21 participants and observers from the human health, veterinary, environment, and food safety sectors in Albania, Bosnia-Herzegovina, Kosovo, Moldova, Montenegro, North Macedonia, and Serbia. And it was jointly facilitated by the quadripartite from global, regional, and country level. The workshop introduced the JRA operational tool and the 10 steps for conducting JRAs. As the different steps were introduced, participants and observers were split into mixed groups and requested to apply the tool to zoonotic disease scenarios that were prepared in advance. And following the application of the tool, participants and observers then worked in country and area teams to agree on the next steps in institutionalizing the JRA process. At the end of the workshop, it was agreed that it had served as an excellent opportunity to advance the operationalization of the One Health approach, to foster collaboration across sectors and borders, and to increase the capacity to conduct joint risk assessments for zoonotic diseases. And with that, I will now hand it over to Golubinga to talk about the experiences from North Macedonia in applying the JRA tool. Thank you very much.
Thank you, Peter, for inviting me to share Macedonian experience. I'm using this opportunity to thank WHO Balkan Hub and WHO Country Office in Skopje for its continued support in the implementation of One Health activities in my country. After the sub-regional workshop on joint risk assessment for zoonotic diseases in the Western Balkans, multi-sectorial team from Macedonia concluded that we need national training for joint risk assessment, which will allow us to conduct joint risk assessment for at least 3 to 5 priority diseases. The workshop, held in Skopje in May this year, aimed to train 25 participants from different sectors, human, veterinary and environment, in conducting risk assessment with One Health approach for 3 selected priority zoonotic diseases, West Nile virus, Leishmaniasis and Salmonellosis. After the short introduction of the joint risk assessment concept and the tool, and situational analysis of priority diseases in our country, joint risk assessment operational tool stepwise approach was followed. Participants were divided in 3 groups, and they drafted risk pathway diagrams for the specific diseases and formulated the risk assessment questions. Characterization of the risk was performed, as well as the estimation of the likelihood and impact, and assigned uncertainties for each risk assessment question. After the presentation of the work, each group proposed different risk management options and risk communication activities that can be implemented at the human, animal, and environmental interface. At the end of the workshop, gaps were identified and adequate recommendations for follow-up activities have been proposed by the participants, such as development of a protocol for formal coordination between stakeholder institutions, strengthening human resource capacities, with possibility for revision and amendment of training curricula in the human and animal health sector, raising awareness of vector-borne and foodborne diseases among the general population, and sharing information on preventive measures using innovative approaches. Of course, adequate resources for implementation of One Health activities are always necessary. Thank you very much for your attention. I am available to respond to any question.
Good morning, good afternoon, good evening. I'm Dr. Dahal. I work as an animal health specialist with the Department of Livestock, and I also work as a core member of the Bhutan One Health Secretariat. Today, I would like to briefly take you through Bhutan's experience on the application of joint risk assessment tool. The Joint Risk Assessment workshop was conducted in April-May 2024. It was facilitated by the Tripartite Organization and supported by the Pandemic Fund. The US CDC also helped us in terms of planning and preparation, and also on the use of online tools. The workshop was inaugurated by the chair of the Interministerial Committee for One Health, and the main objective of the workshop was to introduce the joint risk assessment tool, and also train national One Health facilitators on the process to build capacity for the joint risk assessment. The workshop participation almost equal from human health as well as from the animal health, and there were representatives from the food, the wildlife, the Department of Climate Change, and the university, and also the resource person who took active participation in the workshop. You might be aware by now that the joint risk assessment operational tool, it actually helps us to enhance multisectoral One Health approach in addressing zoonosis, and it also guides in the setup to enable One Health setup to enable joint risk assessment for zoonosis. If you look at the organogram for the Bhutan One Health, the National One Health Technical Committee, which also has agreed to act as a steering committee for the joint risk assessment, which is a requirement for the JRA OT. If you look at the workshop output, the zoonotic prioritization and joint risk assessment, we conducted this workshop as back-to-back workshop. During the zoonotic disease prioritization, we ranked 54 zoonotic diseases and prioritized top 10 diseases for the next 5 years. The workshop also identified gaps in data and multisectoral coordination mechanism, and then also recommended to conduct sub-district level risk profiling for top 2 diseases, rabies and leptospirosis. Following this workshop, we conducted the joint risk assessment for rabies as well as for leptospirosis. For rabies, we generated a risk profile map for at the sub-district level. The darker areas shows higher risks compared to the greener area which has lower risks. And we use the existing data to generate this risk profile map for rabies. For leptospirosis, this was very helpful in terms of the disease identification. While we just completed the risk profiling for leptospirosis, there was a outbreak of leptospirosis in a day soup training. Out of 230 trainees, 180 cases were identified with 89 hospitalizations, and trainees exhibited symptoms of acute respiratory distress mixed with some having flu, fever, joint pains, and sore throat. And there was confusion in terms of the diagnosis. So the risk assessment team was very quick to point out, based on the risk assessment profile and that the team had generated, it really helped in terms of confirming diagnosis and treatment of human cases during the leptospirosis outbreak. This is, I would like to say, this is very helpful for the One Health teams here in Bhutan. Thank you.
Thank you so much, Dr. Dahal, and a huge thanks to all the speakers. Very interesting, different challenges in different countries, different regions, and I can see that there are lots of questions, and I love the emojis coming out, lots of hearts, lots of claps. So congratulations to all the speakers. Over to Aim now for the questions. Now your questions are going to be answered by the panelists directly.
Thank you, Supriya. So I believe one question that I would really hope that some panelists can help us answer is about the evidence of the usefulness of the JRA. So maybe if I may ask Sharon and Hiba to address this about the evidence of the usefulness. So the question is about whether you see the joint risk assessment can impact the outbreak response. And maybe Hiba, you can mention about the results that have been used for certain events and how you found the tool or the process helpful. Maybe sorry to put you on the spot, but maybe we can start with Sharon and then Hiba. Thank you.
Sure, thank you. I think for us, we've had a number of examples where we've used our process, which is based on the JRA. So it's not the same exact process. We don't use a workshop process, but it is, we've had situations where we've been able to quickly bring a large number of people together. And I'd say one of the good examples would be for avian influenza, and specifically when it was first discovered in cattle in the US. And so we brought together people across our human health, animal health, and environmental health sectors. And even just having those discussions, even before we got into the risk assessment, having those discussions was amazing, and we were able to share information, and people found that very, very helpful, and just got us all kind of on the same page and talking to each other, and so I think that was a really good example for that, for the usefulness of that.
Thank you, Sharon. Hiba, would you like to add on your region's use of the results?
Yeah. Yes, as I have even replied to the question here, is that the results, for example, have been used before the FIFA World Cup in Qatar. So it was one of the preparations is to assess the risk from specific diseases that have been recorded in Qatar. So, for example, MERS-CoV was a threat in the Gulf region and also in Qatar. So it was really for them a threat. They need to know whether it's they have to imply more measures or add more money in control of these, or to be very responsive before the FIFA Cup. So I guess it was a very good example. Also, as Lauren mentioned, for Jordan, they use it really as a very effective tool before any project proposal or something. So they use it to assess the risk. They use it not only for the risk, they use it to really understand where issues are standing in terms of the gaps in surveillance and how they can move from these gaps into specific recommendations and specific, very practical activities to be written in these proposals and submit to the donors so that they can get money and implement in a very practical way later on. So this is very brief examples from our region to you. Thank you.
Thank you, Hiba. So just to note that more than 50 questions have been answered already. So please check whether your questions might have been answered in there already. So I will try to pull out more common themes that we have in the questions. And I believe you have a question about Zambia's process, and I've seen that Dr. Raymond has already responded there. Maybe we can come back more to the technicality of the JRA. There was a question about the data management, how you collect data, how you streamline the data collection for joint risk assessment. So I would like to ask from Bhutan whether you would like to add anything to that question.
Thank you, Im. Yes, JRA actually, it's very beneficial in terms of bringing together the One Health stakeholders. It also provides a platform where we can discuss openly with the other sectors and then see, where are the gaps, what are the data that we are missing.
And for rabies, we do have a lot of data, existing data, but for leptospirosis, we use other data like, the rice cultivation area, the presence or absence of the fish pond in a sub-district level. So those type of data were very, very useful. And then also, the JRA provides a platform where people, the technical officials across the sector, they come together, discuss on the data gap, and decide, uh, on the parameters based on the evidence, based on the consensus among the groups. So it provides a very, very good platform to do that. Thank you.
Thank you very much. I've seen from the response, there is a question coming up about sharing the how it's applied in Canada and also in the FIFA World Cup. So if all speakers have more examples to share, please feel free to put in the chat box. I took the liberty, Sharon, to provide 2 examples from Canada that you have in the slides, but others, Hiba from Europe, please feel free to share other reports or the assessments that you have publicly available. I would like to have just one last question, Supriya, if that's okay, about the adoption to the national level. So maybe I can ask Hiendo on this about the adoption at a national level of the JRA process.
Thank you very much. Actually, for Vietnam, adoption of the JRA operational tool at the national level, we can't claim that we have done it perfectly, but in the process, really just by bringing together the One Health stakeholders are really the beauty of the JRA, and we do see the value of doing this. Actually, I was about to say that we don't need to wait until we have the outbreak or we have the cases to do the JRA. In fact, for Vietnam, we did this even before the tool officially launched. We did it for H7N9 using the WHO Rapid Risk Assessment tool, but bringing in animal health sector and even trade sector and other, environmental sector as well to come in and do the risk assessment for H7N9. And in the end, we didn't have any case, but it really helped in, building the surveillance capacity, information sharing, and communication. All these aspects. Really, we do see the value, and then gradually, as the government and also the counterparts see the value of that, commitment is continue to be built on. National level is one thing, but I really see the biggest challenge how to roll out it at the sub-national level. And that goes very much with the capacity building. And that requires time, resources, commitment, because from the tool to the application of this on the ground, it's really a long distance. The tune is one thing really nice, technically sound, but in reality, whenever we conduct the JRA, we don't necessarily have to follow every step, but knowing the principles, knowing the methodology, that will really help the key facilitators to, take the discussion, pulling data together and analyze it and come up with the risk level and inform the decision making. So that is really a beauty of this tool that I say we are very much excited towards this tool, and we just wish that we can have the guideline approved and do it more systematically and more effectively. Yeah, thank you.
Thank you very much. If I may ask you maybe 30 seconds for you to expand on what you are working on in terms of the law and policy, because there is a question about how you facilitate the legislative framework to support the JRA process in the country. Yeah, thank you.
Yeah, thank you for the question. Actually, for risk assessment and joint risk assessment, single risk assessment or choice sector, we have been doing over the years. But for that to be done in a systematic and scientific way, we really need the legal foundation to support that. And seeing that risk assessment is a crucial component in the epidemic intelligence and early warning. The government, we are now in the process of revising the law of infectious disease prevention and control, and that will become law of disease prevention, which is much broader. And the government is able to include risk assessment as one thing that mandated by the law. It's still in the process. We don't know what's the final outcome, but at least we do see that the government sees that risk assessment is really important. So that's what we are trying to really support the MOH at the moment. Thanks.
All right, thank you very much. I don't think we have more time, Supriya, to respond to all of the questions live, but thank you very much for all the panelists who have been very actively responding to the questions in the Q&A box. So we right now have more than 60 questions answered. So please check out the answered box in case that your questions have been responded there. And I'll ask speakers if you have any additional response to speak live. Otherwise, I will give the floor back to Supriya. Thank you very much.
Thank you very much. Thank you very much to all the speakers. As Em said, is there anything else that you would like to expand on? I request all the panelists, anyone who, put the information there. We do have a few minutes because, well, 5 more minutes. So if there's anything else you'd like to add that you couldn't say in the presentation or in the Q&As that were answered by others that you want to add your perspective to, as Em mentioned, no?
Peter has the hand up.
Oh, Peter, go ahead, please.
Yeah, thank you.
The
And
floor.
thank you very much to all the excellent questions in the chat. I see there are a lot of questions about what data is needed and what information is needed and how often do we conduct JRAs. And I just wanted to emphasize the importance of seeing JRAs as living documents and living assessments. They can be updated as the situation changes or that as more data or information becomes available. You can always go back and update the assessments. So they're done at a certain specific time and context, but as that changes, you may want to go back and update it. So there's no clear answer to that question, how often do we need to do it? You need to do it as often as the situation changes, basically. And it can be done with even very little data. Of course, the more precise and the more data and information, and surveillance data and all that is available, the better. The better quality of the JRA you will get, but you can also get a rough JRA done with very little information. So I just wanted to add that. Thank you very much.
Thank you, Peter, for adding that very important point that you can get a rough JRA done even with little information, and that's useful too. Anyone else?
Yes, if you allow me.
Yes.
Yeah, this is Heba Mahrous. Just to add on what my colleague Peter mentioned, regarding the use of the JRA tool. Yes, we do train the people at the beginning during 3 days workshop. At the beginning, it appears a little bit complex, but really the more you are using the tool, the more you find it so easy. You may reach that you can do the whole process in a couple of hours. So it's so efficient. It's so reliable as well. And as he mentioned, and as I mentioned in my presentation, with so little information, you can get really a more concrete, reliable results that you can count on in any future plans. If you are planning for surveillance or any activities, you can understand how the situation concerning these diseases specifically, what are the gaps, and how all the sectors can collectively work to address these gaps. Over to you.
Thank you very much. So with that, I would like to thank all the panelists. initially, I have to say, when we were discussing this webinar and I saw the number of panelists, I was like, oh my God, with so many panelists, how can we have anything meaningful? But you were fabulous in this very short time. You spoke very well about your achievements with the JRA and how useful it is. And I hope for all the participants, you're inspired, and this will mean that you will try the JRA as well. So huge thank you to all the participants. I'd also like to thank on Prasanpanik. I hope I've pronounced it right because I call her AIM. She's worked very hard on this. And also Stefan, who's of course leading on this work. So thank you very much to Stefan and Omon. But also all the people in the background. There's Leslie here, who's worked with the technical team on this. And from the EPI-WIN side, we have Michael, we have Lester today. He's not hosting it, but he's very much involved in the background. We have Sanghamitra from Project Echo and other colleagues from Project Echo. And we have my colleague Burke, who helps us by promoting and putting all this up in the website. So thanks to everyone in the background. I hope, like I said, that you will start thinking about JRAs and the risk of zoonotic disease. At the very least, I hope this webinar has made you, like it's made me, think about the risk of the human zoonotic environment interface in our daily lives. A huge thank you to all the participants who joined today. I love that pig emoji, by the way, whoever it was that did it. Thank you. Very, very relevant. Thank you so much. And I hope you will join us next week. The next webinar should be on the chat link, thanks to Michael, which is on IPC. Oops. I'm not sure what happened there. Do you see it? Can you see my screen with the next webinar? No, I don't know what happened there, but okay. I will then not try to do the presentation link, but just do this. And our next webinar on the 28th of August is on the IPC and WASH checklist for health emergency readiness and response. So this is for all emergencies, what you need to do for infection prevention and control, and for water and sanitation and hygiene. Followed by on 3rd September, introducing integrated outbreak analytics. We'll explain that approach as well as introduce you to another toolkit for integrated outbreak analytics. Then 10th September is on cholera, how you can use risk communication and community engagement to manage cholera. And 17th September, with Stefan and colleagues again, we have a One Health National Bridging Workshop. And finally, on the 24th of September, we look at metagenomics to identify emerging pandemic threats. I will share this also on our website and also in your next email that's sent to you for those of you who sign up to our campaign, so who subscribe to us through our subscription list. But I hope you will continue to join us, and please do write to us at EPI-WIN, EPI-WIN at who.int. We'd love to hear from you. We also love to hear what you would like to hear about from us, what topics you're interested in. And with that, have a wonderful day and a wonderful week. Thank you very much.
Thank you very much, everyone. Thank you.
Thank you. Bye.
Thank you. Thank you.